My name is Hiro Kawashima, the CEO of Prescience Health and your host of the Prescience Health audio blog series. We'll be inviting a variety of subject matter experts to weigh in on topics ranging from AI applications in healthcare to trends in nursing. This week, our guest is Dr. Harneet Bath. Dr. Bath is the Vice President at VEP Healthcare, the former Chief Medical Officer at OSF St. Anthony Medical Center, an active advisor and investor, and an advisor to Prescience Health. He's also a Northwestern Kellogg alum and a board-certified internist. Welcome to our audio blog, Dr. Bath.
Thank you for having me.
So let's start with the first question. As a physician, what unit coverage challenges have you observed and or experienced?
So not only me, but if you ask 100 physicians out there, they'll always complain that most units in a hospital do not have enough staffing or enough good staffing. And having worked in Northern California, Central California, Illinois, other places, it's pretty universal. And from the hospital standpoint, they always feel they have enough personnel on the ground. But physicians always like to complain that they cannot find enough good nursing staff.
Got it. So what are the benefits of good unit coverage, and then what are some of the consequences of poor unit coverage?
Well, you're dealing with people's lives directly. So when you have inadequate coverage, or when you have enough number of bodies, but they're not the right personnel, that can mean a difference in somebody's life and death. And if we're not talking just about life and death, you're still talking about increased length of stay, hospital-acquired infections, complications, other things that can occur. So having the right staffing on the particular unit that adjusts to your patient volume and the patient needs is very critical for any organization.
And then as a hospital executive, how do you currently plan for optimal clinical and unit coverage?
So in most hospitals, they will look at their average census of a particular unit, and what the budgets are done using, with your nursing leaders, CNOs, directors, nursing supervisors, etc. You try to project how many nurses, CNAs, etc. you will need on a given day. And again, these are just averages. You will see some fluctuation day in and day out, as well as weekdays and weekends, as well as seasonal variation. But it's very hard to predict when you're doing it manually on how that will look like.
Got it. So how do you think patient demand forecasting and staffing need forecasting can help with optimizing unit coverage?
So we're seeing a lot of improvements through AI in data and also in operations. And if we can predict better or more accurately than a human being based on different criteria that you're looking at, then it allows the nursing leaders in the organization or the facility to staff much better. So there might be days you need less staff, which means you give breaks to some of the nurses that really need it. And then in the season or the times when you need more people, then you can staff appropriately on the front end and not trying to scramble last moment or on that day or in the morning trying to call 50 different nurses and see who will come in. So it saves a lot of time, effort, and headaches to the nursing leaders and the hospital leaders, as well as to the individual nurses. If I'm a nurse that works on a particular unit, I don't want to be called every morning at 7 and see if I can come in because you're short by 2 nurses. I need predictability in my life as well. So if we can forecast it more accurately going forward, it makes life easier for all parties and probably causes less nurse burnout as well as hospital executive burnout.
Yeah, that makes a lot of sense. I think nurse burnout, nurse retention is a huge topic right now in healthcare, and being able to move the needle on that front is just as important as being able to move the needle on patient care outcomes as well. This is more of an off-the-cuff question here, but when it comes to overall patient care and potential improvements on outcomes, whether it's things like average length of stay or even patient satisfaction scores, what do you think optimal unit coverage, or what role does optimal unit coverage play in that front?
Well, it has a direct correlation because if you're understaffed, then of course you will end up missing things and the patient will stay longer in the facility. Now, can you say that if you're overstaffed, you will really drive down your length of stay and other complications? Well, the answer is no. Because even when you're overstaffed, there are still things that end up being missed. On the other hand, when we're not optimally staffed, it can have a lot bigger bearing on your bottom line for the hospital, which in turn then forces you to use less staff going forward. So we have to be very careful with using our resources and use them only where and when needed.
Well, thanks for sharing your insights, Dr. Bath. I really appreciate it.
Anytime.